Welcome back to Rural Health News, this segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? The Centers for Medicaid and Medicare, often referred to as CMS, released their plan for Rural Health Transformation Fund, which has gained popular attention despite most rural hospitals' opinions that the funds will be minimally helpful in the face of the deep Medicaid cuts. After a 2-tier review process, CMS announced that all 50 states have received funding in response to their individual applications submitted by the State Department of Health and Human Services for the state of Michigan. The primary concern of rural health providers is that state offices will have control over the entire funding, especially since many states, including Michigan, did not accept hospital recommendations into their project applications. Contributing factors to the administrative burden around those funds, CMS established the Office of Rural Health Transformation to oversee the plan. As the state contains most rural hospitals, Texas was awarded the most funding, while Michigan came in at 43rd in the recipient list. Learn more about the Rural Health Transformation Fund at the links in the show notes. On to the damage report. In 2025, emergency department boarding times went downhill. Boarding in the emergency department occurs when patients need to be admitted to the hospital after being seen in the ED, but there are no inpatient beds that are available. This usually means the patients remain in the emergency department until a bed opens up, putting their care at risk in overcrowding departments when new emergencies are constantly coming in. It also means patients in the waiting room without immediate life-threatening conditions have to wait longer to get care. This is a challenge for many hospitals because of the staffing concerns and challenges, the lack of staffing in emergency departments across the United States, and the emergency department volumes as the pressure that it places on inpatient capacity. This past year, the duration of time patients spent boarding in the emergency departments followed previous year's patterns by climbing once again. According to a recent analysis, 25% of patients waited 4 hours or more for a bed in the last 3 years. Some hospitals saw emergency department boarding times of 24 hours. In the winter, this number is usually worse as accidents peak and sickness spreads. This is important because rural communities across the nation need urgent and emergent care more than ever, and the challenges that result in longer ER boarding times are not easily solved. As the care demand grows and patients become more vulnerable, boarding is expected to only increase further, putting hospital staff and those they serve at greater risk. Solving this would take an industry overhaul, from proper staffing to improved reimbursement to process all of the changes necessary to fix the problem. I sincerely hope that today's success story is only the first chapter of sustaining this program across the United States. The 340B drug pricing program provides affordable pharmaceuticals to rural hospitals across the country. It also provides great care and services and much-needed medications to patients in need in those respective communities. We go into greater detail in other news episodes, but our latest concern has been the proposed shift from the model that it exists today to a rebate pilot program, which would severely limit access to affordable drugs for hospitals and the healthcare providers. Last week, U.S. District Judge Lance Walker of the District of Maine placed a temporary restraining order to prevent the new rebate model from going into place at the start of 2026, arguing the rebate model would put detrimental cost on hospitals and cause a permanent disruption to services. This order came at the prompting of the American Hospital Association, the Maine Hospital Association, and 4 safety net hospitals that understood the intrinsic value of the current 340B model. This isn't the end of the fight at all. to sustain this valuable program, but it's certainly a win along the way. Thank you to our sources today for this episode: Becker's Healthcare Review, CMS, Michigan Medicine, and First Word Pharma.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.